the Living Well Toolkit came about at least in part over a number of years. We were starting to collect a lot of data from people about their experience of rehabilitation services and what helps or hinders their engagement in the process of recovery following significant injury or illness. And we started to get lots of repeating themes coming through time and time again in this research, which led us really down this pathway to think through, well, what are the key tipping points for people? What are the things that either tip someone in the direction of not doing so well, having a negative healthcare experience and not so good outcomes, to people that tip in the opposite direction from that. And so the kinds of things that were coming through repeatedly in our research was lack of person-centred communication, poor continuity of care, so across services and across health professions, and a lack of future-focused care, so a lack of understanding what does the future look like for this person, what are their hopes and aspirations for the future, and how does what I do now at this point in their care trajectory impact on what might happen for them in the future. And also, how can we better harness the strengths and resources of the individual and their family to really capitalise on those in some way to optimise outcome for those people. So those seem to be the three things that were coming through, and so the toolkit really, that was the starting point for the toolkit, was thinking how can we improve these three key things that impact on outcome for people. And so we put in a project to the Health Research Council some years ago now. So this has been a long time coming to get to this point, where we started by interviewing patients and practitioners about those three core processes and what would help or hinder or make those better for people as they journey through their rehab process. And so the toolkit really has arisen out of that data. And some of you know that we've piloted the toolkit here and in other services, and we've made some refinements, and we're in this next phase now where we're looking to implement the toolkit into practice and explore and evaluate how that goes for people. So what is the feasibility of that? How does it work when you're implementing it into routine practice? And how does that impact on outcomes for people as they move through their rehab?